So Mark, you really landed on something very powerful here, and it really touches the next question. So I wonder what you think about it. This is how do concepts of masculinity and strength and not showing up like weakness, right? How does that show up in the therapy room? These ideas that for both the person seeking therapy or the therapist, okay, how does that play out? These concepts around black male masculinity.
Well, I think we need to deconstruct this heteronormative patriarchy system that we have to deal with, because the black male spectrum is very wide. There's different ways for black men to experience love, to express love. There's different ways for black men to express their identity in terms of their sexuality, their manhood. Um, Personally, I don't like the word masculine. I don't think the word masculine serves our 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 culture, our history, our spirituality. I think it's time to use something else. I don't like the term toxic masculinity. I think it's rooted in anti-black racism. We talk about toxic masculinity. We don't talk about Asians or Italians or Germans or Russians. Why is toxic masculinity only assigned to black men? So, in terms of masculinity, no black man can define masculinity for all black men. I respect Malcolm X, but he can't speak for everybody, you know. So I think we have to provide spaces where black men can feel comfortable enough to decide what masculinity means or doesn't mean to them, instead of us trying to impose our beliefs and values on the whole entire um, race of people.
Got it. Dr. Henderson, your thoughts?
Sure, and I think the good professor Tucker there covered a lot of ground there. So I'm going to take it from a different perspective. I think stigma is an overwhelming challenge for dealing with the overall challenges that we face, and we're going to seek therapy, as well as the challenges that have us coined and phrased in what would be called strength or not showing weakness or masculinity, and so on and so forth. The stigma is still existing in 2026, where it is something that you are not a strong man, a black man, as it will, that can represent not only yourself, but your family and your children if you're seeking health. Now, do I think that's changed? We have the data that supports that those who are what would be considered middle America or middle class, et cetera, and beyond, are becoming more engaged in therapies, traditional and non-traditional rather. However, when you talk about the most vulnerable populations, those who are under the poverty line are right there at it, and the middle class is continually being pushed down towards that, as we see what's going on with unemployment, what's going on with those who are uninsured, which brings me to another, my second point, the ability to receive care, and everything from the traditional, the Affordable Care Act or Obamacare, to those who have some sort of insurance, does not adequately cover therapy and mental health. A lot of therapists and my peers, before I left that field to pursue research and the scientific endeavors in order to, chase down a cure, we were faced with, wow, the guidelines and the policies and laws are trying to eliminate being able to bill for healthcare services that are done online or that aren't in person. They want to cut it in half. They want to cut it by 25%. And so the cost of doing that business, the cost of carrying the adequate insurance, and so on and so forth, doesn't make it feasible for a psychologist, a therapist, or psychiatrist, a counselor to um, do treatments and therapies without being able to bill it at full cost and rate. Whereas there's also the challenges that they're facing with being on site, being a part of an HMO or a PPO, and all the structures there that are really, really trying to squeeze out the individual practices and make you all part of one big homogeneous mix there, where they're all under this umbrella at a very controlled cost. And in order to stay as a private and offer those services, who exactly can afford that, right? The most vulnerable populations cannot. They cannot swipe their card that they have from Medicare or Medicaid, et cetera, and say, I need to see a therapist, because that doctor no longer takes it. And often cases they can't afford it. Now, are they doing pro bono? Are we going into the community centers? Are we working with our churches, et cetera? Yes, in some cases, but in many cases they simply aren't. And you have to pay out of pocket for to receive care, and they just can't afford it. And that is a tremendous problem facing America right now, because until we get what's going on with the healthcare system under some type of mandate, which requires protections for those who offer treatment and therapies for mental health and illness, versus the what I would call almost an attack on the ability to offer that care at a reasonable, feasible rate, where you also can keep your doors open and pay the insurance necessary. Until we get those things done, which is why we work on the political determinants of health to address policy, the social determinants of health, before you even get to a place of crisis and needing mental health. We have to go back and really get a hold of the system which is surrounding healthcare and mental health, and that is one of the key determinants from Black male and all minorities from receiving healthcare, because it's just not built into their insurance anymore, and it's been cut. Like music has been cut out of like the physical ed's cut out of the my daughter's school. They're like, you don't have to take it, but you can pay for it, but it's not part of the curriculum anymore. So if you want to send an extra $1,000, we'll pay someone to do it. It's shocking when we know for a fact that if you give the basic math, English, sciences, but if you have music, right, to Professor Tuggle's conversation about music therapy, which is very popular. I have an amazing program at SCAD here in conjunction with Emory and also at NYU that has really, really reached a lot of folks that they otherwise can't reach, who have serious chronic mental health issues. They're taking music out of the equation when it is a powerful tool for healing and learning. But you got to pay for it, and the healthcare system is no different.
Dr. Henderson, both of you, Professor